All right, now we are getting into the skeletal system. I suggest that you watch this video prior to watching the musculature. So you'll see an outline here, some of the major bones in the body. The average human has 206 bones of the body, but it's actually not uncommon to have plus or minus a few. We have within the body a division for the skeletal system between the axial skeleton and the appendicular skeleton. So essentially everything that is bright white here is axial, and everything else that's a yellow, actually looks bonish color, is the appendicular. Looking here at the spinal column, you have a division between the types of vertebrae. And again, vertebrae is the name of these types of bones. You have the 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. They each have, if you look at them unarticulated, they actually all kind of look a little bit different, okay? 2 that look incredibly different, though, are what's called the atlas and the axis. And those 2 are actually responsible for most of the some of the movement with your head, like being able to turn left and right like you're saying no. We also have the sacrum and the coccyx, and these actually fuse in development. So your sacrum was actually previously 5 separate vertebrae, but during the development, they fused together. And the same with the coccyx. The coccyx was 4 separate vertebrae that end up fusing into one relatively small bone. We can talk about curvatures of the spine. So the cervical and lumbar curvatures are typically described as lordotic, and the thoracic and sacral curvatures, or pelvic curvature, is called kyphotic. So combining forms, arthro is joint, burso is bursa, carpo is carpals, which apply to the wrist only. You have chondro, which means cartilage. Again, if you remember, like the right hypochondriac region of the abdominopelvic cavity. And then costo, which specifically is the rib itself. Again, here, cranio is the skull. Femoro is femur. Ilio is the ilium. Ischio is the ischium. Now, ilio and the ischium are, if you go back and look, the bones that make up the what you would consider like your pelvic bones is actually 3 fused bones. The ilium and the ischium are 2 of those 3, and the third being the pubis. Then kinesio is movement. So if we say kinesiology, that's the study of movement. Kypho generally just means hump, but remember, kyphosis is a specific direction of curvature that you see with the thoracic and the pelvic curvatures. Lordo, described as bent forward, again, is the cervical and the lumbar curvatures. Necro, or like necrotic, means death. Osteo specifically means bone. Now, this next one's a little strange. You might have heard the terms before, but phalangio. We essentially talk about phalanges or a phalanx. So these are very, very specifically the bones that make up like the actual fingers and the actual toes, right? So your thumb and your big toe are essentially homologous to one another, and they're special because they actually only have 2 bones in them, okay? They have what's called a proximal and a distal phalanx. Now, the other 4 fingers on each hand and the other 4 toes on each hand have 3 bones, all right? And Again, there's a proximal, there's a distal, but this time you have what you would call an intermediate phalanx. Okay. Now, pubo, again, pubis. So I mentioned this already. When we talk about the pelvis, we essentially see there's what's called a false pelvis and what's called a true pelvis. You can see kind of a very firm outline of the bones here. That's kind of the true pelvis, whereas the general area is called the pelvis as a whole. The ischium specifically is, you would know it as like your butt bone. So what's called the ischial tuberosity is a specific part of this bone, and it's actually the part that when you sit down, that's the bony part of the ischium that's making contact with what you're sitting on. It's also very important because the hamstrings attach there. The ilium has a very nice prominent feature. So if you look at this very lateral component, you'll notice that there's a part that kind of sticks out here. This is called the, and stick with me, the anterior superior iliac spine. Okay? Because believe it or not, there is also an anterior inferior iliac spine. There's a posterior superior iliac spine and a posterior inferior iliac spine. These are all going to be abbreviated. So like the anterior superior iliac spine, you'll commonly hear called the ASIS. Okay. Another important idea to distinguish is the pubic symphysis is the location where the two pubic bones come together. And a symphysis is actually a description as a type of joint. It's a symphysis joint. Again, combining forms here, you guys can go through most of those. We got like spondylo, vertebro. I don't ever really hear this one much, but rachio. These all apply to vertebra, spine, vertebral column. Scolio apply to the spine. You talk about scoliosis. It's a lateral curvature of the spine. Sterno is the sternum. Tino or tendino, like tendinosis condition. It's the tendon. And troph or tropho is development. You got different cells called like in the development of the body, you have cells called trophoblasts. Trophoblasts literally exist to build. They're developmental building tissues. Suffixes: asthenia is weakness. Desis is a surgical fixation. Malacia is a softening, so you can have like osteomalacia. Schisis is a split or a fissure. Prefix: inter is the only real one we're going to focus on here, and inter means between. So like I said before, you have the intermediate phalanx. That is the phalanx that is between the others. In that case, it's in between the proximal and the distal phalanges. So you'll see a lot of terms here referring to signs and symptoms. A few ones to point out: atrophy kind of means like a degradation of tissue. Bradykinesia is like slow motion. Dyskinesia is dysfunctional movement. So you can talk about kind of unintentional. Dystrophy, again, same thing, is a dysfunction in the development of muscle. Hypertrophy, we can talk about specifically with muscle. Hypertrophy is the idea of building muscle tissue, so making larger muscle, but we can talk about hypertrophy with other tissues like bone. Sternalgia, kind of like a pain behind the sternum. So again, you can break down word parts for the disorders. So we talk about arthritis. It's literally inflammation of the joints, right? bursitis, inflammation of the bursa. Chondritis, like a costal chondritis. So this again is two different things we've talked about already. Costo, pertaining to ribs, and chondro, which pertains to cartilage. So a costochondritis is an inflammation of the cartilage around the ribs, and your ribs do have quite a bit of cartilage on them. So we talk about a cranioschisis. That's like a fissure of part of the cranium. Kyphosis is a term for excess kyphotic curvature. That would end up giving you kind of like a hunchback. Lordosis is something that you it's again excess lordotic curvature. Lordosis is actually very common with pregnancy. We have osteoarthritis, which again is essentially joint tissues, or the joints between two bones are going to be covered in a special type of cartilage, and I should say synovial joints, actually, because there are many different types of joints. But osteoarthritis is generally what you would describe as the synovial joints are degrading, and the cartilage isn't protecting the two bone surfaces anymore. So now you have inflammation of both the bone and the joint itself as well. So you can see that general idea here. It's very, very simple and straightforward. You got extra rubbing that occurs, and it just leads to inflammation. It's not very fun. More words here: osteopathy, a condition of the bone; phalangitis, inflammation of the phalanges. Subcostal is actually a very important term because it applies to like below the ribs. In fact, there's a very important nerve called the subcostal nerve. It can also be just simply referred to as T12, but the subcostal nerve is very important for certain muscular functions. So again, I've described previously kyphosis, lordosis, and scoliosis. But what you see with A, again, typically seen in pregnancy, A is going to be lordosis, B is going to be kyphosis, and C is a scoliosis. So here you're going to see more terms based around procedures, an arthrogram. Arthroscopic basically means you're putting a scope into the joint. Arthroscopy is pretty much the same thing again. And then we have an EMG or electromyogram, which we actually talk more about in the musculature presentation. So a arthroscope is a instrument used for examination of a joint. Arthroscopy is the act of performing a joint examination, right? We talk about EMG again, like I said, a little bit more in the muscle description. So you see here surgical terms. There's tons of surgical terms. You talk about like an otomy. So bursotomy is kind of like a removing of something. An ectomy, again, same general idea, removing something. Excuse me. So we talk here. Again, we've already talked about most of these going into this. Carpal is pertaining to the wrist bones. Costochondral is pertaining to the ribs cartilage. Femoral pertaining essentially to the upper leg or the thigh. Hypertrophic is kind of like a condition of enlarged growth. Intercostal this is important because intercostal talks about between the ribs. The intercostal space, very important because there's essentially a vein, artery, nerve, as well as 2 different muscles in each intercostal space. Iliac, we can talk about iliofemoral. There's certain things that have names like that. Intervertebral, so we can talk about like intervertebral discs. That's the discs in the spine. You know, somebody says they have a herniated disc. It's a intervertebral, which means between the vertebrae. And there's intercranial. You'll see this commonly talked about like intracranial pressure, so pressure within the cranium. So again, here we're talking about the discs. You kind of have 2 components to a disc. This gel-looking substance in the middle called the nucleus pulposus, and then this outside area called the annulus fibrosus. You guys don't really need to know that, but general idea is that they are in between each vertebrae. A term you might have heard before with myasthenia would be myasthenia gravis. It's a musculoskeletal condition. So we're looking here at words not built from word parts. Now, some of these words that are on here, particularly the orthopedics, orthopedist, and osteoporosis, are terms that I don't necessarily agree being on this list, but technically. So carpal tunnel syndrome is literally a condition related to the carpal tunnel, which is a very specific part of the wrist. A fracture is just going to be the generalized term for a break of bone tissue. Herniated disc, again, it's a herniation of the disc. Disc is going to get kind of compressed and pushed out. Magnetic resonance imaging, or MRI, very high, well, not necessarily high tech, but a very effective tool that uses magnets to produce images. And I talked about this before, I believe, in the directional term document, but an MRI will take images in the transverse plane as if when you view it, you're looking up from the feet, okay? Nuclear medicine, again, general idea, is involved around imaging. Now, orthopedics is the study of everything ortho, and you can think about ortho as a conglomeration of bones, joints, muscle, all of that. Orthopedist would be somebody that's specialized in ortho. Osteoporosis is a condition of pores being formed in the bone, typically related to calcium or vitamin D deficiencies. And then rheumatoid arthritis, RA, is a autoimmune condition where the body essentially is attacking its own joint tissues.